As we get into the changing seasons, it can sometimes be a challenge for your lungs, so it's important to remind ourselves to get lung screenings and to get them from the best. Our next guest is a guy who told me less than a year ago I did not have lung cancer because of one of those screenings. It's Dr. Rob Headrick from CHI Memorial. Dr. Rob, good to see you.
Great to be here.
Why does the change of the seasons put a stress on our lung and our breathing capacity?
The cold air brings a lot of challenges to the lungs. One, we're inhaling it in, and our lungs like a little bit more humidity and warmth, but also brings a lot of viruses that allow to stay alive longer. So they're easier to spread between individuals, and we're in closer contact in colder weather indoors.
Yeah, part of what you have done over the past several years is develop increasingly new and killer technology as it comes to detecting lung problems, particularly lung cancer, as you did with me a few months ago. Start to finish, you can find out if you have something like that in a really short time span now. Because you and I have talked before, nothing's more aggravating than to go in for a serious test and, oh, we'll call you in 19 days with the results.
Well, we've gone from just in my time in healthcare, from having to listen to the lungs, to now I can see the lungs. A piece of technology that was very difficult to find and operate and expensive is now very reasonable. And we can put it on a platform where we can go to a convenient place. So I can now see what's going on in your lungs. We can pick up things like lung cancer when it's early and very easy to treat. We can look at how your lungs are aging and do things to help you prepare for this cold season and the flu season and the time of year that's very difficult for all of us to get through from a pulmonary standpoint.
Hadn't been that long ago, lung cancer was pretty much a death sentence.
Yes.
Not the case anymore.
Well, we misspoke and miseducated the public about lung cancer. We thought it was just about tobacco. It's really about your genetics and a whole lot more complicated things. We also felt like you couldn't cure lung cancer. It was a very difficult disease. It's actually very easy to treat, but you have to find it early. The only way you can find it is through lung screening.
How early, obviously, earlier detection on any sort of cancer is best, especially lung cancer. What's the rate of survival now for folks who get it detected early?
Well, we find it early. It has no symptoms, so you have to go looking for it. So anybody over the age of 50 who's had family history of any kind of cancer, certainly been exposed to anything from foundry work to tobacco, certainly presents himself at a higher risk. When we find it early, the survival goes from about 20% chance of cure to 90% chance of cure.
Wow.
But what's even better, the treatment gets really simple. You won't even miss work.
And you have been one of the pioneers in putting one of these screening labs actually on wheels and taking it to different corners of the Tennessee Valley area now.
So we have the Breathe Easy mobile unit. It was the first in the country of trying to make healthcare convenient. Take the piece of technology I have to see your lungs and particularly find lung cancer early, and go to where you live, go to where you work. Make healthcare simple.
You screen somebody in our parking lot right now. How long does it take before you're able to tell them yes or no?
The same time it takes you to fill up your car with gas.
20 minutes?
It's that quick.
Wow.
Less than 10 minutes. You'll be on and off the bus. You'll get the results the same day. Reduce the stress levels. Let you know what you need to do to help stay healthy. The even amazing thing is we're not just seeing the lungs, you're seeing the heart, you're seeing all the things that catch us by surprise and complicate our lives. Ideas to make healthcare easy. You want to get your lungs screened and the rest of you checked out, go to the best. Go to Dr. Rob Headrick and the staff at CHI Memorial. Dr. Headrick, good to see you as always. You are always welcome to return at any point. Check them out. There is the website, CHI Memorial. Get your lung screening done. Get it scheduled today. It could save your life.